I think you might be talking, but I can't hear you.
Okay, great.
Yep.
Let me make sure the screen share is working.
Sure. I just made you presenter, so hopefully
Oh,
it'll
great. Yeah, first I was like, oh, I don't really know how this is going to work. Um, okay. Looks like it's sharing the right one.
looks good.
So I'm going to close some stuff out so my computer doesn't
Sounds good.
struggle too much. And yeah, I'm ready to begin whenever you guys want.
Sounds good. We'll give it another minute. It looks like folks are jumping on. Does look like we have about 80 registered. If you are with us today already, feel free to go ahead and introduce yourselves in the chat. I see some folks are doing so. Alrighty, it is 12:30, so we are going to go ahead and get started. Welcome everyone. My name is Chelsea Ader. I'm the Senior Behavioral Health Consultant on the BHIPP team. Just want to thank everyone for joining us. I know it's been a few months since we've had a resilience break, so we're excited to be back doing these. I'm going to be facilitating today, and so just for folks who might be new here, a couple quick housekeeping items. You'll notice that you are automatically muted and video is off, just since we have a large crowd. So please feel free to use that chat function throughout. We will have 15 minutes at the end of the session for question and answers. So feel free if you would like to put your questions in throughout. We'll get to them at the end. I'll make sure that we cover those, or if you want to save them to the end. If you have any tech issues as well, please feel free to message me in the chat. Just a quick reminder, sometimes that chat kind of automatically bumps you to only messaging one person or just attendees. Please be sure to mark that as everyone so we can all see the chat. And I think that might be mostly it. Oh, just keep an eye out for a link for the survey evaluation for CME credit. For continuing education, you do just have to be on for at least 45 minutes in order to receive that. So I'm going to just go ahead and introduce our speaker today, Dr. Hal Kronsburg, who's going to be presenting on school avoidance.
Hi, everyone. I'm Hal Kronsburg. Thank you so much, Chelsea, for the introduction. I appreciate it. So just a few things about me before I go ahead and get started. So I am a child psychiatrist over at Johns Hopkins. I work in our school-based mental health program over there and also the child mobile treatment team. So I work with a lot of youth that are in Baltimore City, and also as part of the child mobile treatment team, a lot of really vulnerable kids who are experiencing not just psychiatric illness, but a lot of psychosocial strain as well. But, you know, in some ways, most relevant to this presentation, in my past life before I went into medicine, I was actually a public school teacher, and I taught seventh grade math and special ed, and also was an assistant basketball coach as well. So spent a lot of time in the school system too. And that's something that's been kind of helpful in understanding some of the challenges that teachers face, primary care physicians face, that all sorts of folks face when it comes to kind of ensuring that kids are getting the most out of their school experience. So I'm going to go ahead and dive in and start talking about school avoidance, and in particular, kind of the approach to, I think, evaluating and managing it. One thing I will just say, for folks that are sending things through the chat, it's like not appearing on my primary screen, so I'm not going to be able to see it until the end. And I know we're going to try to have time for questions then, so hopefully we can have a conversation at that time. So just a little bit of housekeeping. So I have no potential conflicts of interest. As I mentioned, I'm on the faculty at the School of Medicine at Johns Hopkins, and I'm part of the Echo Project Echo that's run through Maryland BHIPP, and we get funding through HRSA for that. So the goals for today are, relatively modest in some ways. We want to talk about taking a multi-step approach to evaluating and managing school avoidance. We want to start thinking about the 4 different functions of school avoidance, because it's easy to kind of treat it like it's just one thing, when really it's actually the same manifestation of many different things. And then finally, talk a little bit about some of the comorbid psychiatric conditions that are often present in the setting of school avoidance. So I think in some ways the most important thing we can do as clinicians, primary care providers, whatever, is to know what our job is exactly, because it can be really easy to feel like we've got to do more than we're capable of doing, and in some cases not empower other people whose help we're going to need to solve the challenges of school avoidance. So I think kind of a good analogy for thinking about this is, primary care providers are the quarterbacks. And, the idea being this is not a problem that any one person alone can solve, which also means that it's not a problem that any one person can be worrying about. And just like, the best quarterbacks in the NFL, they need a whole team around them in order to actually succeed. And so I kind of, would sort of chop things up into 2 things. The first thing that we want to do is to do what we can. And that basically means, often we're in this position of kind of liaising between schools, parents, kids, all of the, in some cases, mental health providers. And so that enables us to be uniquely positioned, I think, to understand the problem better than anybody else can. And then finally, especially for folks who are doing a lot of the sort of mental health treatment from primary care provider offices, it's also really important to recognize, to cut through the noise and to diagnose and treat what's there and is treatable. So those are I think that the 2 primary things that we can do, but we need help from others. And so one of the most important things we can do, once we understand the problem, we want to be able to provide an explanation for other folks. Because once everybody understands the problem, it's so much easier to get everybody on the same page to actually start solving it. There's also, oftentimes important to refer out when needed for therapy, but also to enlist parents for help. And that may be in some cases the most important thing. We want to really empower parents, and in some cases kind of help them get things in order for themselves when it's necessary too. And then finally, we need to enlist the school to help as well. A lot of times the school is going to need to make accommodations to make it easier for kids to start attending school again and to kind of ease their way in, oftentimes in kind of a more graduated process, or provide the supports that kids need. When it comes to understanding the problem, I think the most important thing we can try to do is see things as one of 2 choices. That is, when you're meeting a kid who's not going to school, what we want to figure out is our kid running away from something? In many cases, school itself. What is aversive about the experience of going to school? Why is there avoidance happening? But it's not just avoiding school when we see kids engaged in school avoidance. Oftentimes, it can also be kids running towards something else. And I'll talk a lot about what that may mean exactly. But I think this idea that school avoidance is just a kid saying, I don't want to go to school because I don't like school, it's often much, much more complicated than that. And I think in describing the approach that we want to take to sort of understanding and intervening, sometimes it can be really helpful to start with actual, like a case. And that's what I'm going to do today. I'm going to talk in particular about a kid named Joshua, who I worked with a number of years ago. And I think this case is so rich because there's so many different elements of why kids might kind of avoid school that helps explain why we were in the position that we were in. And hopefully some elements of his story are going to sound awfully familiar. So Joshua was a 13-year-old boy. He was living in both parents in a stable household. He's in the 7th grade at a very well-resourced but pretty intense public middle school. He had never been in treatment before he came to me as a child psychiatrist. You know, in general, people had really positive things to say about Josh. He was a shy kid, but he was really gentle. He was a little bit overweight, but in general, a really good athlete, loved playing baseball, and had a lot of strengths. He was never a really strong student and had often struggled academically, but he was never failing. He was always getting kind of C's. And for the most part, parents felt like that was reasonable and they felt like he was doing his best. And so when I first met him, it was December, but he'd actually stopped going to school altogether in October. So this problem had really, really kind of taken root. And now folks are starting to get very anxious and very upset. So the first thing I do when I encounter a kid who's been avoiding school is I want to try to figure out like what has everybody tried already? Because the last thing I want to do is just kind of recapitulate a process that hasn't succeeded at all. Another thing that's often really interesting about kids refusing to go to school is it feels sometimes a lot like kids who engage in restrictive eating. That is, it's often a really complex problem, but because the solution seems so simple, that is, all Josh has to do is go to school, problem solved. In the same way, kids with anorexia, all they have to do is start eating and the problem is solved. That can cause a lot of strong feelings to emerge within the system too, because everyone winds up often feeling like there should be a very simple solution, and why isn't someone else doing what they need to do to make this happen? So basically, the first thing I did was I reached out to school, or actually a more accurate way to say it is school reached out to me before I actually saw him. So the school had mentioned that they had called the truancy officer over to Josh's house, which seemed to actually make things worse. They had actually filed on Josh's behalf with CPS for neglect because he hadn't come to school for so long. They had very contentious meetings with mom, and I was actually faxed 40 pages of emails exchanged with mom. And the school's perception, because they actually said it was, once he walks through the doors, he's fine. That is, when he gets in the school doors, he's able to tolerate things throughout the course of the day, and they don't really see what the big problem is. And so from their point of view, this was all on mom to solve. So from mom's point of view, she tried a lot though. She tried bribing Josh with video games, taking things away from Josh, also video games. She'd lost her cool and yelled at Josh, admitting that at one point she yelled, "You're the reason this family is falling apart," at him, which is something that I think is worth kind of holding on to when we talk about things later. Mom also faxed me 40 pages of emails that she'd had with the school. And his mom said, I don't understand this. Everything would be better if he would just go to school. So what do we know about school avoidance? And I'm going to take a little bit of a detour in sharing some of the literature and some of the research that we have on it. And actually, one of the biggest studies that we have comes from the Great Smoky Mountain Study, which is this collection of about 4,500 kids in North Carolina that were anywhere between ages 9 and 13. We have this huge data set. There's so many different ways in which we've looked at this sort of cohort of kids. In some ways, about 34% were below the federal poverty line, and the racial composition was 70% white, 22% Native American, and 6% African American. And so in this study, they looked at all of the students that were in this cohort over a 3-month period. And for every kid who had engaged in a school refusal for at least one day, they tried to get a sense of, what was going on with this kid? How do we understand what is going on in general with kids who avoid school? So they actually divided things up into 2 different categories. And I think this is useful because, again, it sort of makes the point that not all kids who avoid going to school are anxious. So they separated kids into anxious school avoiders, so kids who failed to reach or would leave school because of anxiety, and then truant school avoiders. And those are kids who either failed to reach school or just left school without permission, or didn't have an excuse either. And so there were a couple of differences. Number one, the number of kids who engaged in school avoidance due to anxiety was pretty low. It was around 1.6% of this cohort. But then kids who were described as being truant, that was closer to 6%. And you can see there's a pretty substantial difference in age. So 12-year-old versus closer to 15-year-old, and also differences in gender as well. So kids who engaged in truancy were more likely to be male, whereas the anxious school avoiders had more of a 50-50 split. And again, I think it's really important to think about, what category is the kid that I'm working with in? Largely because, with anxious kids, we need to address the anxiety. And often with kids who are engaged in truancy, there needs to be more kind of supervision and consequences and more of like a different sort of behavioral approach. Um, but, it's not just that they divided kids into these categories. They then proceeded to ask pretty carefully, well, what's going on with these kids? How do they differ from one another? And so here you can see in two different columns. On the left column, it's the anxious school avoiders. And in the right column, it's the kids who engaged in truancy, who, I think were sort of being categorized as almost more defiant in not going to school. And so among the anxious school avoiders, you have about 20% worried about what's going to happen at home or something happened to a parent, and then closer to 40% worrying about fear specific to school. And I think this is really important because it highlights the extent to which, some kids are worried about school, but other kids are worried about actually something else. And that might be the thing that's keeping them from going to school. And then you could see on the kids who were described as being more truant, much less likely to fall into or to have those same sort of worries. And then they looked at, well, what is it actually like for these kids in school? And, in some cases, in thinking about what are some of the anxious kids actually anxious about, what do they want to either run away from or run towards? A large portion of these kids do experience bullying as well. And they have lots of difficulties socially. But you can also see about 20% of kids, had a hard time making friends in part because of aggression. And that may actually be instances where kids who feel like they are a little bit not in control of themselves when they're in school and the anxiety around how things are going to work out socially when they're there. You can see both groups still have pretty high rates of conflictual peer relationships, but it was really the anxious group that had a higher level of social anxiety as well. So again, there are lots of different things that may be driving some of the anxiety for kids who are avoiding school because of anxiety. And that can be anything from being worried about being bullied, worries about performance or other things that may be happening in school, but also worries about what might be going on at home, and in particular from separating from parents. The other thing that I think is worth also just recognizing is for many kids who aren't going to school, there does seem to be kind of some social skills deficits. And those are things that may kind of need to be overcome for kids in order to get the most out of their experience being in school. So another thing that I think is important to understand about kids who don't go to school is, do they have some sort of comorbid psychiatric diagnosis? And so one of the leading researchers on school avoidance is someone named Christopher Kearney, who's at UNLV. And there are a number of things that he had studied in trying to get an understanding of school avoidance. And so one of the things that they have actually is they were looking at kids who were referred to mental health clinics specifically for school avoidance, which is something that definitely is a reason why many kids will come to us in psychiatry. So a couple of things came out from looking at those kids who made it to clinic with that specific sort of chief complaint. So the first is that actually the majority in this case were male, and the mean age was about 11 years. And in looking for kind of the diagnosis, this is grouping all kids together. So not just the sort of anxious school avoiders, but also kids who were more truant. And so you can see actually the leading diagnosis among kids who are avoiding school is separation anxiety disorder. And with these kids, it's not so much that school is necessarily incredibly aversive, but it's the separating from home that is so difficult. And remember, there are lots of kids who are worried about something that might happen to a parent when they leave. We also see large numbers of anxiety disorders kind of in general. So, 20% their primary diagnosis was separation anxiety, 10% more generalized anxiety disorder. There were a smaller portion of kids who had major depression as their primary diagnosis, only about 5%, and an even smaller number of folks who had social anxiety disorder as their primary diagnosis. And in some ways, most importantly, about 33% of kids actually didn't meet diagnostic criteria at all. And so that's where, when there isn't a diagnosis, we also want to think about what else could be contributing to kids not wanting to go to school. So in some cases, it may be bullying. Not wanting to be bullied is not enough to meet criteria for any psychiatric illness. In fact, I think it's pretty reasonable to want to avoid a place where you feel like you're constantly being picked on or in some cases physically harmed. Another example, one of the kids that I treat, one of the things that he would do when he didn't go to school is he was washing windows at intersections. And he described making about $200 per day when he was doing that. And this is someone who instead found that there was a greater reward in not going to school and in fact doing something different. So again, that's not a psychiatric illness. That is finding something that is more motivating to him than going to school. So again, that's why we want to think there's many of these kids often don't have a psychiatric illness that we're necessarily going to need to be treating. And instead, we want to focus more on what sort of environmental intervention needs to be made. So I do want to get back to Joshua because, there was a lot going on here. And again, I always wanted to ask this question, what is he running away from and what is he running towards? So in some ways, Joshua's interview was not terribly earth-shattering. A lot of things that he said seemed pretty reasonable. So one thing that I think is the case for him that was really important that I think people had lost sight of was, from his point of view, he was saying, I want to go to school and I try to make myself go, but I just can't. It is too hard. I can't do it. And so, I got a sense of him a little bit more and his, overall worry state, his early life history, things like that. And one thing that was really striking about Joshua is he was saying, I always worry about everything and I always have. This is, one of the kids who, classically we describe as a worrier. And there were lots and lots of sort of bells flashing in my head that was like, oh, there's definitely an anxiety disorder here that I think we need to address. But that wasn't it, because when you ask him about school itself, I mentioned that he struggles with his grades, and he's usually right around kind of a C student. But it was interesting because he said this year, school just seems too hard this year. He's always struggled with reading comprehension and staying organized. That was always a real challenge for him. But the academic demands this year felt more than he could manage. And that was something he was pretty upfront and honest about. So, in completing the psychiatric assessment, one thing that I did feel was evident was that, Joshua had a more kind of generalized anxiety disorder. And I'm not going to go through the entirety of the DSM criteria, but one thing that I think is important is in some ways, generalized anxiety disorder is more a diagnosis of exclusion. And it speaks more to almost like anxiety in a broad array of things. And some people almost think of it as being almost more temperamental. These are kids who are just wired to worry a lot. There's excessive anxiety and worry on more days than not, difficulty controlling the worry. Lots of somatic symptoms can be associated with it. And again, it's not better explained by something else like panic disorder, social phobia, separation anxiety disorder, or something else. The prevalence is actually fairly low, between 1% and 3% of pediatric populations. And that's because oftentimes people will land on generalized anxiety disorder when really the most parsimonious explanation is something like social phobia or specific phobia or separation anxiety, something like that. So again, it's almost more of a diagnosis of exclusion in some ways. So it usually peaks around age 9 and 10, and then it dips, and then it starts increasing in its prevalence again around age 13. Another reason why it kind of seems a little bit more temperamental than almost circumstantial is it runs really strongly in families, and it's fairly stable over time. if it's left untreated. But the thing that's really dissatisfying about seeing a kid who's had a pretty abrupt onset of school avoidance when they have generalized anxiety disorder is, the case for Josh. He's always been anxious. So why is this happening now? Because an anxiety disorder is not sufficient to explain why someone might abruptly be avoiding school. So I learned more about what was going on in the family. And in particular, I heard more from mom. So she mentioned a number of things. The maternal grandmother, who was very close to Josh, had died in September, which was 1 month before he stopped going to school. And not only was Josh really close to his maternal grandmother, but that left mom really struggling. She ended up getting depressed, losing her job, and there started to be a lot more fights in the house. And again, we think about what's somebody running away from, what's somebody running towards. And we think about the Smoky Mountain study and the number of kids who were worried about separating from a parent. When you talk to Josh, you found out more and more, he was kind of running towards home. He was worried about his mom, and he was worried about what would happen during the date. Were she and dad going to keep fighting? Would she potentially leave? When she yelled at Josh, "You're the reason that this family is falling apart." I think what Josh heard more than anything else is this family is falling apart. And so separating became very, very frightening for him. And so I think in some ways the most important diagnosis for Josh was the development of separation anxiety disorder. And again, I'm not going to go through all of the criteria, but I think the most important thing is, there's a lot of anxiety around separating from an attachment figure with a number of different symptoms, but it needs to last at least 4 weeks. There needs to be an impairment of functioning. And again, it can't be better explained by another psychiatric illness at all. So the prevalence of separation anxiety disorder is around 5% in pediatric populations. And again, you have a peak between 7 and 9, and then it starts to go down around age 11. And it doesn't really bump back up again. So separation anxiety disorder is actually one of the most common reasons that kids will present to treatment, in part because, it's not just impairing for kids, but it's often like impairing for parents too. Even more than generalized anxiety disorder, kind of interestingly, separation anxiety disorder runs in families. But this is something that often, quote unquote, just kind of goes away over time. So 80% of kids no longer meet criteria 3 years after diagnosed, even if you don't treat it. There are folks who do believe that without treatment, separation anxiety disorder will crop up again later in life and emerge as panic disorder. This is actually something that's in the DSM. I'll be honest, I have a hard time finding a lot of hard evidence for that. But one of the interesting things about the treatment of panic disorders, there is an evidence-based treatment that's very focused on, it's a psychodynamic treatment, and it's a lot of talking about early childhood separations. And for whatever reason, that seems to be something that is very helpful in the treatment of panic disorder, is going back and kind of thinking more and talking more about early childhood separation. So I think there is something to this idea that difficulties with separations may be linked to panic disorder in later life. And so, I think many of us who've dealt with anxious kids know that the apple doesn't fall far from the tree. And, in Josh's case, it's clear that his struggles seemed to get worse when his mom started to struggle. And so, I think it's worth asking, what do we know about the connection more broadly between child and parental psychopathology in this setting of school avoidance? And in fact, I had a supervisor who was, very experienced, very wise, and basically said there's no such thing as school avoidance because it's always a family problem at its root. And that's the thing that needs to be addressed. I don't know that I agree quite that strongly about it, but there have been some studies that look at what's going on in the families of kids who don't go to school. And probably the best study that we have is in the flagship child psychiatry journal. And this actually looked at the kids of the parents of 51 kids who had an anxiety disorder and at least 15 days of school avoidance as well. And so these were kids who about half of them had separation anxiety. And then there was an assessment of a lifetime history of psychiatric illness in mothers and fathers. And sure enough, there's actually kind of really significant histories of anxiety as well in parents. about 80% of mothers of children who have anxiety disorders who avoid school also have anxiety disorders. About 50% also have had depressive disorder as well. The numbers are a little bit less for dads in these cases. However, still substantially higher than the average population in the area of anxiety disorder in particular. And so I think this is something that we also need to inquire about is how is the family doing when we have a kid who is not going to school? Because we may want to kind of gently guide parents and families to try to make sure that they're addressing their own psychiatric health. So there are other things that are a little bit beyond what I've discussed here as well that I think are always worth considering when we're evaluating school avoidance. And so one is there was a large national crime victimization survey that was published by the Department of Education that looked specifically at bullying and the impact of bullying on school avoidance. And so just to share a little bit more, you can see in these slides that there's kind of divides bullying into direct bullying and indirect bullying. So direct is kind of more confrontational bullying, whereas like indirect is more about kind of excluding kids and isolating in some ways. And so just in general, so about 24% of sixth graders reported bullying in a 6-month period. And the numbers start going down by the time you get to high school. And in fact, only about 7% of 12th graders reported experiencing bullying. However, like overall, between 3 and 7% of kids reported missing some element of school. And that can include extracurricular activities as well as a result of bullying that they experienced. So, if you think about it, 24% of sixth graders experience bullying. And of those, you could have somewhere between 3 and 7% missing school because of that. So it's always something that we want to have on our radar as well when we're talking to kids about what their experience is like in school, because that's absolutely something that kids will try to avoid. And oftentimes not really want to talk about. So I do think it's important for all clinicians to really try to familiarize themselves with some of the bullying policies that are available in the states. So Maryland actually used to have a much more kind of updated website that had like kind of more guarantees about the process, but they've subsequently changed it a little bit. But there is sort of a model policy on bullying, harassment, and intimidation, and you can see the link here. And that basically includes kind of the guidelines for statewide policies for different school districts, and also does have something of a rough timeline for how schools are going to respond to reports of bullying. And I think a lot of parents aren't necessarily familiar, but there actually is a bullying reporting form that the school kind of needs to respond to. And so a lot of times we will be kind of encouraging parents to fill out the form and make sure that the school does its and it holds up kind of its end of things to make sure that the environment is safe for the kids that are there. Another factor, obviously, that has impacted school avoidance in the last couple of years is COVID-19. There's kind of a disappointingly small amount of data that can be kind of linking school avoidance specifically to COVID. So overall, there's some thoughts that, school avoidances seem relatively stable numerically after the pandemic. I think that's a little bit complicated for a number of reasons. One of which is, I think a lot of kids who had a lot of really significant anxiety-related school avoidance ended up not actually re-entering schools and wound up doing virtual schooling kind of going forward, or homeschooling after, in some cases, 2 years of doing virtual schooling. So I think that number might be a little bit misleading, but honestly, I don't think I've seen really compelling data that kind of, convinces me one way or the other. But that's sort of my hypothesis, just based on the kids that I'm working with. But we do know, for anxious kids, that long layoff made for a pretty challenging reintegration as well. And one thing that we also know about the impact of COVID is there were over 140,000 kids who ended up losing either a primary or secondary caregiver during that layoff. And without a doubt, that has had an impact on so many of them. There is also some data that suggests kind of overall worsening mental health among kids. So, for example, there's been a rise in pediatric ED visits for suicide attempts, especially among adolescent girls. Poor mental health is associated with kind of avoiding school. Kids who have anxiety disorders and depression are more likely to avoid school, even if it's not necessarily the kind of primary driver of the school avoidance. So, let's talk about how we go about looking closely at school avoidance and actually making a treatment plan. And so again, I fall back on this idea. So it's a simple behavior, but there are like complicated antecedents to it. And we kind of have to figure out which of the four different functions of school avoidance are at play. So I mentioned Chris Tierney, who was the researcher who looked at those kids that were presenting in clinic for school avoidance. And he's published a lot on this idea that there are like four different reasons why kids avoid school. In some cases, many of these reasons are active at the same time, but we should be able to try to divide or try to think about the kids from these four different perspectives. So one question that we ask is, what internal feelings are school avoidant kids seeking relief from? So that can be like anxious feelings in particular, but often those are expressed somatically too, with headaches, stomach aches, things like that. So what feelings are they avoiding, but also what experiences are being avoided? And that can be things like bullying, difficulties with academics, other kind of social experiences, or a feeling of lack of safety in the schools. The other question we want to ask is any positive attention being gained from school avoidance? Again, this is where we think about kind of what is this kid running to? And so often that attention can be from parents, but not necessarily only from parents. It could be from other people. And then finally, are there any tangible benefits from school avoidance? So for example, the kid who gets paid $200 to squeegee on the corner, that's a tangible benefit. Being able to stay home and play video games, tangible benefit. Being able to stay home and smoke weed all day, tangible benefit that these kids are experiencing. So we want to try to think about all four of these different perspectives. So, if we've identified that our kid is avoiding negative internal feelings, so just some additional things to know about and consider. Generally, this is more common for younger students. They're the ones who are avoiding their feelings. There's often somatic symptoms that are going on there. And here's where we want to try to treat whatever psychiatric illness may be present. The diagnostic picture might be mixed. So, you may want to consider screeners with a PHQ-9, for instance, for depression, or a SCARED or a GAD-7 for looking at anxiety. For kids who are trying to escape school-related aversive social or other experiences, this tends to be a little bit more rare and more with older students. It's often linked to very specific negative experiences. There's high prevalence of anxiety disorders. Oftentimes, these are kids who also may have cognitive challenges. The work may be really difficult. It's worth really trying to get a sense of what is their day-to-day like in school. What are they struggling with? What are they actually actively trying to avoid? In other cases, it may be to gain attention from significant others. So that's more common among younger students. This is where separation anxiety has a really high prevalence. I'm sure we've encountered schools where a kid is really acting out or refusing to participate in school. And so what does the school do? It calls their parents, say, come and pick your kid up. And they have managed to perfectly positively reinforce that behavior. And so this is where we want to be really careful to think about, is this kid experiencing some sort of overall kind of positive reinforcer for not going to school in terms of their kind of relationship with others? And then finally, there might just be tangible reinforcement outside of school. These are the kids who are more likely to have oppositional defiant disorder or conduct disorder, who are leaving school because they're not supervised and they can go do unsupervised kid things when they're not there. So, to make this even simpler than just the four different kind of drivers of school avoidance, again, I like to think of, there's a group that's running from school and there's a group that's running to someplace else. So those that are avoiding negative internal feelings or school-related experience, they're running from school. Those that are trying to, pay close attention to or get attention from family or significant others, they're running to something else. And also kids who are just able to stay home and play video games all day or do something else, they are running to something else. So you can do these assessments just in your interviews, just talking to parents, talking to teachers, talking to kids, and develop your own hypothesis. However, if you're interested too, there actually is a validated school refusal assessment scale, and so this is well established in the literature. Again, this is something that Chris Kearney developed, and he did it in part so that he could try to figure out, can we develop a questionnaire that tells us roughly which of those four categories our kid fits into. There's a child scale, and the link is here. There's a parent scale, the link is here. For whatever reason, you have to go someplace else to learn how to score it. There's 24 questions for each version 2. And it looks roughly like this. So this is the child, this is the parent, and they're just a bunch of questions that you answer that are on this Likert scale from 0 to 6. I haven't used this a ton. I've used it a little bit, and I find it relatively helpful, but in general, I don't know that it does a lot that you can't get out of just an interview and a conversation. But if you can get a parent and a kid to do this before they come to the office, there can be some value in kind of tightening up our assessment from there. So I felt like we finally had a decent idea of what was driving Josh to avoid going to school. He had mentioned he's always been anxious. Probably that was always something that could have happened, but ultimately a couple of things needed to happen to push him over the edge. One were the challenges that mom was having and his worries about mom and being separated from mom and his broader worries about the families, but also the fact that he was finding school academically to be a lot harder than it used to be. And he was finding that to be pretty challenging and frustrating. So let's talk about how we built a plan for Josh. And I think this is something that can be analogous to what we do with any kid. So again, we think about what are the 4 different profiles of school avoidance. And when we have the negative, avoiding negative internal feelings, what we want to do is treat the underlying disorder when it's applicable. If it's to escape aversive experiences in school, then we want to try to address the actual difficulties that they're encountering in school. If it's gaining attention from others, then what we want to do is we want to educate parents, gently encourage family treatment when it's necessary, work with parents on reinforcement. And then finally, when it's just about tangible reinforcement outside of school, we need to be able to make sure that we're increasing supervision and limiting the availability of those reinforcers. Simple things, and I know this is something that many of you have spoken about with families, simple things like just making sure that the video games aren't around in a kid's room all day when they're not going to school. So to help Joshua, even though it was a simple behavior, we needed to address all of these causes as best we could concurrently. So first, I wanted to make sure we were addressing the generalized anxiety, but also the separation anxiety as well. There were academic concerns that I thought needed to be recognized. And then finally, school and home's responses to Josh, mainly by trying to punish him or yell at him, was only increasing his anxiety and only making things worse. So the first step to address this generalized anxiety disorder, so one was kind of referring to therapy, and he started CBT for anxiety. And I think in the cases of anxiety disorders, CBT is far and away going to be, of all of the widely available treatments, the most effective one. And we also started medication treatment. So I started Josh on an SSRI as well to try to address his anxiety. So we were trying to take kind of a maximalist approach, and the evidence seems to suggest that medication and CBT concurrently is going to work most quickly and most effectively for the treatment of anxiety disorders. But again, Josh has always had this generalized anxiety disorder. Addressing that is not going to be enough. So we also had to address Josh's separation anxiety, and in particular his worries about home. So I made sure to meet with parents solo and to kind of better understand their perspectives and experience. And in that meeting, I ended up actually gently and ultimately successfully encouraging mom to seek treatment of her own and to try to help them understand that Josh is pretty worried about what's happening in the family too. And I think that was something that parents hadn't really realized. And so mom started to become a lot more thoughtful about the way that she spoke with Josh. And dad was actually a lot more present in talking with Josh too. And they try to work much more together in addressing this problem to kind of show Josh that, they were, that he as much as he possibly could, didn't need to worry about them. But again, that wasn't it. So the next step was to address the academic concerns. And so Josh is somebody who had always struggled academically and had never had any testing at all. So we referred him to neuropsych testing, and it revealed significant learning disabilities, but also a bunch of strengths too. And that helped mom and dad push for an IEP to address some of his learning issues too, and give him some of the supports that he needed there. And then finally, we needed to think about, what was going to be a more effective way to respond to his behavior, because currently school and home were just kind of making things worse by just punishing and kind of yelling. So one thing that mom did was she decided she was not gonna reinforce school refusal behaviors. But she also said, one of the things that Josh enjoys most in this world is playing baseball, and I worry that if I take that away from him, he's going to lose out on one of the things that he really uses to define himself and give himself confidence. And I think mom was absolutely right in thinking that. So basically, on a day that he didn't go to school, she decided, I'm going to make this as boring as possible. So she locked up all of the cords, all of the remote controls, anything that could have allowed him to sort of fritter the time away, and just kind of make it a boring day. And she said, I'm only going to fight with you so much to get to school. But if you're not going to go to school, then we're just going to kind of be waiting. School, once they started to and then she said, it was important that after 4 p.m. at the end of the school day, we're going to still treat it like a regular evening. I'm not going to try to like take away other things that I think are really important for his kind of physical and mental health. Once the school started to understand the problem, they started to take a little bit more of an empathic stance. So one thing, they allowed him to re-enter school in kind of a graduated way. So he started to come, Josh described the mornings just felt a little overwhelming for him at this moment. So he started coming to school at 10 a.m. for a little while. Likewise, they were trying to not punish Josh and overwhelm him with missed work, and really, do what they can to positively reinforce just him coming to school. And then they ended up creating a plan that allowed him to take a class off when he felt that he needed to. And just knowing that that was available to him was enough to help him reduce the anxiety of being in the classroom. So it was this kind of like multi-part process that I think was ultimately able to successfully get Josh back into school. If he was missing some of those things, honestly, I think it could have still worked. But, our approach was, let's try to address everything that we can, because these are things that are all going to help Josh in the long run anyway. So in summary, I think we think of school avoidance, it's a simple behavior, but it's got a really complex etiology. When we're evaluating kids, we need to think about not just psychiatric disorders, but also learning issues, bullying, and I think in some ways, most importantly, family issues. And I think each problem is going to need to be addressed to maximize the chance of improvement. And then kind of most importantly, again, it's easy for people to sort of play anxiety hot potato in some ways with school avoidance, but everybody needs to be on the same page. Parents and schools need to be kind of working together and understanding the problem the same way to ultimately help our kids get back into the classrooms. So there are a couple of references too that I think are worth reading. I'm not going to go through them, but they should be available wherever you guys are able to get these slides. And that is it. So I think I can stop sharing the screen. And yeah, happy to.
All right, everyone, feel free to enter any questions in the chat, and we will take those as they come.
Oh man, there's a lot of stuff in the chat. I think it's all from Lily. Okay.
She was dropping some links in there as you presented. There was one question, Dr. Kronsburg, about it was surveys you mentioned at the beginning about, is fear of gun violence sort of added into account with some school avoidance?
So that's a really good question. And at least some of the larger surveys, I don't think really fully address it. And so in thinking in particular of like the Smoky Mountain studies and things like that, I don't think it's looked at. And it's a really good question. And one of the things that I think is really important that we do when it comes to working with kids with anxiety disorders is we make sure that we validate the valid. And there are, there was a school that I worked at in Baltimore City, an alternative high school where there were, I think, 8 students that were murdered within a 1-year period that were attending this school there. And there were a lot of kids who expressed not just outrage, but a lot of fear about what was happening in their communities. And I think that's absolutely understandable. And it's understandable that would be a reason why kids might be afraid to go to school. I think it's also important that we recognize, anytime we're addressing kids with anxiety or adults with anxiety, when we're doing CBT, we spend a lot of time looking at the evidence and trying to get a sense of, how do we understand what's actually going on? Where is the violence happening? Is there a reason to be afraid in the school building itself, or maybe is it elsewhere where things are actually quite a bit more dangerous? So I think it is important to spend time not just sort of dismissing the concerns that kids have, but actually examining the evidence and seeing to what extent that fear should be should justify not attending school. And I think that's a different question of, am I right to be afraid?
Another question on any suggestions how to approach the topic of parents needing RX for their own issues, which are contributing to the child's problem without sounding judgmental. For example, brief role play or a demo of what you have said to struggling moms.
Yeah, no, so that's a really good question. And that's tricky. And I think a lot of that, I would say I don't have a one size fits all way to speak to parents about it, because my relationship is really different with many of the parents that I've worked with. In in many instances, when I have closer relationships with parents, I can be a little bit more kind of blunt, and a little bit more honest. But one thing that I always tell parents, especially parents who've gone through, in this case, in this mom's case, there were some pretty clear and understandable triggers for her starting to get more and more depressed. And then the other thing that I always just try to do is like validate how hard and to not to speak too glibly about it, but almost like crazy making school avoidance is, because again, the solution is so simple. And so parents get so frustrated, they feel so down on themselves, people get so mad, they get so much blame from the school that their kid isn't going, because the solution on a policy level is, let's send the cops to their house and like maybe threaten to put parents in jail. So I try to really validate how difficult the situation is for parents, and to kind of continue to state that the way we're going to be most successful in helping our kids out is if we are at our best. And many parents will say something like, well, I'll get help for myself when my kid starts doing better. And that's one thing that I'm always pretty upfront about, kind of dissuading people of the idea that it can work that way. We're all in the same way. If we're in a boat that's taking, this is an analogy I'm just making up right now, so it may not be very useful, but if we're in a boat that's taking on water, we all have to kind of bail it out together. If only one person is doing all the bailing out, the water just goes to the other side of the boat. And so, I think we need to, as empathically as possible, let parents know that they have every reason to be struggling at the moment, and the way to maximize their chance at success is everybody involved just being the best version of themselves. And that's where treatment can come in, especially if we can kind of explain to them, you're not struggling right now because you're crazy, you're struggling right now because this is an incredibly hard problem to solve. And trying to be as validating as possible. And now I'm just looking through and some compliments, and thank you for that. And Oh, do I have an opinion about how to recommend that student go on home and hospital? Oh boy. So that's a really complicated question, and I can tell you like what my attitude about home and hospital is. I'm really glad that that's something um, that was put into the chat. So again, here it's really important to get a sense of what is the reason that the kid is not going to school. And I think when the kid is not going to school because of their own kind of feelings, that is, if it's an anxiety disorder that's like kind of primarily kind of driving the school avoidance, I actually think home and hospital is a great way to facilitate that avoidance and make your problem worse. Um, and so I am very wary of using home and hospital for kids that are anxious. However, there are kids who might be experiencing bullying. There might be kids who just where the school is not willing to make the accommodations that this kid may need, and as a result, the kid is, you know, getting in trouble and getting suspended, because they feel because their needs aren't being met. When the sort of intervention needs to take place on the school side of things, then I'm a little bit more willing to consider it, and almost as a way of saying to the school, okay, you guys have 30 days to either start up an initial IEP meeting or to figure out what you're going to do to ensure that the acute safety issues with bullying are addressed. I will sort of be very explicit that, I will give the school X amount of time um, to try to solve these problems. Because, for instance, if a kid is continually being bullied, for instance, um, I don't feel great about sending them right back into school if it's not being addressed at all by the school. And then likewise, if the school is not uh, willing to make the academic accommodations that a kid needs, I'm willing to give them a little bit of time to like meet and figure out what to do. But ultimately, I feel like I'm just allowing the school to kick the can down the road when I fill out home and hospital. So I'll be like very, very explicit about I am willing to do it on these conditions, and I will not be renewing it after certain dates. So that's when I think the intervention needs to take place at the school level. But if it's just for anxiety, I think then it can sometimes be the worst thing that we can do. And then have I worked with families where there are multiple children with school avoidance? Yes, I definitely have. And one of the things that has been interesting is um, just the heterogeneity of those kids too. It's easy to be like, well, both kids are avoiding school. So I'm thinking in particular about one family where this is a major issue, and one kid is reluctant to get to school in part because he's really worried about his mom and leaving his mom alone, who struggles a lot with a number of different challenges. And another kid in the family has a lot is much more concerned actually about the experience of school itself. And so as a result, the interventions are like totally different that we have for each kid. But I'm not familiar with studies that looked at kind of clustering within families, though I would think that would happen, but yeah, I'm not sure if I've seen much data there.
All right, I think that might be all the questions for today. So thank you, Dr. Kronsburg, for a wonderful presentation, and thank you everyone for joining us today. Take care. Have a great rest of your week.
All right, thanks everyone.